Thanks so much for joining. We have a town hall presentation that we're going to be going through today to talk more about the COVID-19 vaccines. I'm going to do my very best not to speed talk, but it's an exciting topic as more people choose to get vaccinated to protect themselves and the community against COVID-19. I'm going to move through these slides pretty quickly. Usually we do a poll when we have a large live um, presentation. What I'd like to mention on this slide is that even if right now you are watching this presentation and you're not planning on getting the COVID-19 vaccine, but you're listening to this presentation to be able to share reliable information with others, I just wanted to let you know that this is a safe space and you are welcome. We recognize that everyone has a different journey as they process and decide on the COVID-19 vaccine. The purpose of this presentation is to be able to provide reliable information so that you can make an informed decision about getting vaccinated in the future. And so, as we continue to think about what are some of the hesitancies, we have some listed here, but we know that there could be other reasons as well. And so we invite that feedback as well. Even if it's not a live, session now and you're watching this at a later time, feel free to put that information. You can respond to the video if you're watching it as well. All right, so worldwide, there's lots of different manufacturers working on making COVID-19 vaccines. 8 are approved worldwide. For the purposes of this presentation, where we are now is that we have 3 that have authorization to be used in United States, which include Pfizer, BioNTech, Moderna, as well as Johnson & Johnson. The vaccine, Pfizer vaccine, has received full authorization through the FDA in the United States. So, how does the vaccine work? So, I know this is a wordy slide, but what I'd like to bring your attention to are the 2 areas that are highlighted in red. So, the viral vector on the right-hand side of this slide shows you that Johnson & Johnson is made with a viral vector, which is an approach that takes a harmless virus and delivers the viral gene and shows your immune system how to build immunity against the COVID-19 virus. Whereas the Johnson & Johnson vaccine they use messenger RNA to send a message to tell your body how to respond, your immune system, how to respond against the COVID-19 virus if it sees it in the future. So with any of these vaccines, you cannot get COVID-19 from the COVID-19 vaccine. All 3 of these vaccines do not contain live or inactivated virus, so there is no risk of becoming infected with COVID-19 by receiving the vaccine. COVID-19 virus by receiving the vaccine, there's no risk of becoming infected. So that's really, really good news. I know a lot of people have lots of concerns, just like with any other vaccine, or many other vaccines, I should say. There's no risk of getting the virus when you receive the vaccine. So this slide shows you a couple of the differences between the vaccines. Pfizer and Moderna are a 2-dose series, and Johnson & Johnson is a 1-dose series. And so there's a little bit of a difference in timeline as to the time between your first and second dose for Pfizer and Moderna. So this slide shows you some of that information. So I know a lot of people have questions about how the vaccines were made so quickly. And our response to that is that there was a lot of groundwork that was laid over the last 15 years of research, as well as billions of dollars that was put towards supporting the effort of manufacturers developing a vaccine so we can get out of the pandemic. Thankfully, no steps were skipped in the making of the vaccines. All vaccines would go through these same steps. And so phase 1 of clinical trials, phase 2, as well as phase 3 are all the usual steps that a vaccine manufacturer would go through in order to get a vaccine into distribution phase, right? And so what I would say is that usually the time that it takes to go from one phase to the next, there's usually a lot of funding that needs to be raised in order to transition. But because of the billions of dollars that was put towards manufacturers not having to wait that time to raise those funds, they were able to move forward from one phase to the next with ease. All right, so the vaccines are, there's a little bit of a difference between efficacy. What I would highlight is that all three vaccines have shown incredible efficacy in United States and protect against severe illness, avoiding the ICU, hospitalization, as well as death from COVID-19. So that is wonderful news. So while we're not 100% effective in protecting everyone against COVID-19, highly, highly effective in protecting people from severe illness, ending up hospitalized and in the ICU, and death from COVID-19. So that's really great news. So is the vaccine safe? Absolutely, yes. So before the vaccine was able to be distributed, it went through the same safety phases within the clinical trial that are geared most towards safety, as well as after the vaccine. There is a website called vSafe where after you receive the vaccine, you are invited to provide your feedback about how you felt after you've received it. So we have millions of people that have, given their feedback on how they felt after the vaccine, and we have that feedback there. There's also a place where providers can provide feedback about any adverse events after receiving a vaccine. So after you've received the vaccine, there's an opportunity to provide that feedback as well. So we can say with confidence that the vaccine safety is continuing to be monitored throughout. Which brings me to sharing more about the temporary mild side effects that someone may experience after receiving the vaccine, which is actually a good sign that your immune system knows what to do if it were to see the COVID-19 virus in the future. It knows to turn on and fight it off. So on the right-hand side, you'll see that those temporary mild side effects could include soreness and redness around the injection site, fever, chills, fatigue, joint pain, muscle pain, as well as headaches. Thankfully, we're talking about temporary side effects. Temporary means 24 to 48 hours after you receive the vaccine. And we're talking about mild side effects to say that, you may not feel that well while you have these side effects, but it wouldn't be something that's severe, requiring you to go to an ER or anything like that. So temporary, mild side effects that someone can experience after they receive the vaccine. So who can get the vaccine? The Advisory Committee on Immunization Practices continues to provide feedback to increase the chance of everyone to enjoy health and well-being. And so identified a phased approach in our allocation of the vaccine, the way we were able to distribute it. At this point, we're in phase 2, where everybody that's 12 and older can receive the vaccine. So to those that are immunocompromised, your provider, oncologist, your immunologist has told you that you have some things that are compromising your immune system, we encourage you, or they would encourage us to get a third dose of the vaccine. And so if you've gotten Pfizer or Moderna, so that information is available as well as far as a third dose is concerned. So I know you've heard a lot about Delta spreading fast, more infectious, can cause more severe illness, as well as, most of the concern is with those that are unvaccinated. Thankfully, the COVID-19 vaccines are highly effective in preventing severe illness and death, as I've already mentioned previously, and that would include to the Delta variant. Vaccinated people can appear infectious for a shorter period of time when they're vaccinated. And so that's good news, as well as a reason to still get vaccinated, even though we hear about the Delta variant. So as most of you already know, that those that are 12 to 17 can receive the vaccine. While it has been approved for those that are 5 to 11 to receive the vaccine, we're getting additional guidance as well as getting the vaccine to be able to begin to distribute to those that are 5 and 11. But that has been processed, and we are looking forward to starting that as soon as we receive the vaccine, getting it out the doors and into arms of those that are 5 and older. So that will be for the Pfizer vaccine. And so to find an appointment to be able to receive the vaccine, you can go to vaccines.gov. You can contact your child's pediatrician. You can go to our website or call our call center. So our website, you can go to vax.rchd.com, as well as you can call our call center if you need help scheduling an appointment. That phone number is 804-205-3501. For those that are under the age of 18, we will need a legal guardian or parent or adult to be able to give permission for that consent form. And then as far as who comes to while the child is being vaccinated, that could be any adult over the age of 18. So that's good news there. So this slide will be updated in the coming days as we are approved to give the vaccine, Pfizer vaccine, to those that are 5 and older, 5 years old and older. Good news. We're just waiting on the vaccine and some other logistical steps that we need to do in order to begin distribution. Boosters are now available as well, so authorized for those that have received Pfizer and Moderna. This slide may feel a little bit tricky, but what I would say to you is on the right side, you'll see when you need to receive it. That's the main thing there. So if you've received Pfizer and Moderna, that would be 6 months. If you received Johnson & Johnson, that would be at least 2 months. But you could mix and match if you wanted to. We're not requiring any documentation of the booster. We do like for you to try to make an appointment whenever you can so that we can anticipate with that timeline as to when you received your previous vaccines. But you can follow up with your healthcare provider if you have additional questions there. But there's more information to the left side of the slide to say some of the stipulations with the vaccines. But the main thing I'd probably bring your attention to is the timeline as far as getting boosters. 6 months after you receive Pfizer and Moderna, and then 2 months after you received Johnson & Johnson. All right, so some more, some details on statistics. So over 11 million people in Virginia have received the vaccine as of October 27th. In Richmond and Henrico, we have administered over 665,000 doses of vaccines, which would bring us to about 71.5% of Richmond and Henrico adults have received at least 1 dose. And then 65% of all those eligible, the population of Richmond and Henrico eligible, are fully vaccinated. So that's really exciting news to be able to protect those that aren't vaccinated yet, right? And those that haven't been vaccinated yet. That's really good news. So how do you get the vaccine? I've already mentioned this on a previous slide, but absolutely worth repeating that you can go to vax.rchd.com to learn more. You can call our call center at 804-205-3501, as well as you can go to vaccines.gov. So let's say you want to find the nearest place to you. It makes sense for you to go to vaccines.gov. You could type in your zip code, do a search to find out what pharmacies in your area are offering the vaccine of your preference. All right, so even after you get vaccinated, we want to make sure that, if you feel sick, please stay at home. If you have any, respiratory illnesses or any other challenges, continue to do a good job with washing your hands, covering your cough or sneeze, and doing your best to protect others from COVID-19. While you may think it's a cold, continue to do good hand hygiene to protect others. Those 2 years and older should be wearing a mask and continuing to physically distance indoors and outdoors according to CDC recommendations. So I know a couple people have questions about how to reproduce their vaccination record. So you can go to the website of vaccinate.virginia.gov. You can also call the statewide hotline at 877-829-4682. You can also follow up with your healthcare provider about receiving another copy. If you go to vaccinate.virginia.gov, it will ask you for your name and date of birth in order to get a digital copy of your vaccination record. It'll say when you got your first dose and when you got your second, or when you were fully vaccinated. So if you need that for a for your workplace or whatever, or just for your records, feel free to check out vaccinate.virginia.gov to get more information. So how do you learn more about the vaccine? While I'm sharing this information with you today, this information is as of today, right? So 2 weeks from now, things may evolve and continue to change a bit, but feel free to find reliable information at the CDC, at Virginia Department of Health, at our local health department's website in Richmond and Henrico. This is not an exhaustive list of reliable websites, but to name a few, you want to just make sure that you're using a reliable source for the information that you're gathering, and it's not hearsay or a rumor or a myth, that you are getting reliable information. So in summary, why should you get the COVID-19 vaccine? Because it's effective. We talked about the effectiveness to prevent you from ending up, having severe illness and ending up in the hospital or in ICU or dying from COVID-19. Because it's safe. We talked about the temporary mild side effects that someone could experience, and that overall safety continuing to be monitored, and the vaccines are safe. Because it's free. While we may collect your insurance information, or depending on where you go to receive the vaccine, they may ask if you have insurance. There's no out-of-pocket cost to you to receive the vaccine. Because ending the pandemic depends on most of us getting vaccinated. I talked about most of us getting vaccinated and protecting those that aren't vaccinated yet, can't get vaccinated yet, or have chosen not to get vaccinated yet. Because the rest of us need you to stay as healthy as possible. And so this relates to, you're important to your family, you're important to your work, you're important to your community. So as each of us individually stay as healthy as possible, overall, collectively, we stay as healthy as possible. Because COVID-19 is fighting more than just this virus. So we talked about the equitable way that we distributed the vaccine when we did the phased allocation approach. And there's lots of challenges in our community, and we'd love to get out of the place where COVID-19 being one of those things. And so COVID-19 vaccine will help us fight more than just the virus. Dr. Fauci did a wonderful presentation, and we've linked this YouTube video for your viewing. So you can go ahead and click that link to be able to get more information as well. If you wanted more information as a healthcare provider about best ways to approach hesitancy as well as educating others. So as I mentioned previously, usually when we're doing a live presentation, we usually try to ask this question again to see if, maybe you were in the maybe, or maybe you were no previously, how your feedback has changed now as far as if you're planning on getting the vaccine. At this point, many people have heard this presentation. I think when I checked our records or statistics recently, or our data recently, we had, I think, done or talked to over like 7,000 people and given information about the COVID-19 vaccine. We invite you to provide feedback on if you've heard this information before, how informative was this presentation? All right, so we can open it up for a Q&A if anybody has any questions, but 3 things that I would ask of you is that if you find an opportunity, go ahead and get vaccinated. You can go to our website, call our call center to get more information. We encourage you to share your experience on social media. Please avoid sharing your personal information, such as your date of birth and full name and all of that. And then make sure that you're sharing reliable information with others and stay well informed about updates and how things evolve as time goes on. This last slide, before we open it up for questions, feel free to put questions in the chat, or you can come off mute in just a moment. But this last slide here in our presentation references where we got our information from to put our presentation together, as well as a lot of people have questions about boosters or the ingredients of the vaccine. You can find that information there. I've mentioned it before, but we do have a statewide call center. If you've got questions and you just want that direct question answered, feel free to call our call center at 877-VAX-IN-VA, which is 877-829-4682. So we can open it up for any questions that you may have. All right, so hearing no questions at this time, I will go ahead and let you go. Thank you so much for participating and watching this presentation. We really appreciate you. Thank you so much for continuing to share reliable information with others.